Okay, Chapter 6, we're talking about prevention and control of infection. So hand washing is the most important part of prevention of infection and the spread of infection. But infection is a disease or process that happens because microbes have infested your body. These microorganisms are so small that they can't be seen with they can only be seen with a microscope. So you may not know that they're there, but there are germs and diseases and fungi everywhere. The most common types of microorganisms are going to be viruses, bacteria, and fungi. They all are microscopic germs. So when you have a break in your skin, the infection can get into your body. This invasion or growth of microbes in your body is then called an infection. These microbes naturally grow on your skin, but because there's a break in the skin, then they cause a problem. You need to know what the word fomite is. So a fomite is an inanimate object or substance that's capable of carrying an infectious organism, such as a germ, a parasite, an infection, a fungi, virus. Therefore, they're going to transfer things from people to person to object. Any kind of object is going to be a fomite. So a mop cloth, the cells on your skin, your hair, your linen, your clothing, your bedding, all of these things are common sources of contamination or common fomites. The way that lice get spread from kid to kid to kid at schools or even in nursing homes between patients is because of the linen or the pillowcases or things that are shared that are cloth that these little lice or bugs are growing on. Infection control also has a chain of infection. So there are several links to the chain of infection, and you need to know that you can break this chain of infection at any link. The chain usually starts with the infectious agent. So there is some kind of bacteria, fungi, or virus. Diagnosis and treatment of these infectious agents and cleaning them off and washing your hands helps to prevent this spread of infection. We have a source of infection. The source is going to be your fomite, your person, your equipment, the water that they're growing in. We have educations, we have environmental sanitation, we have disinfection that can help break this chain of infection. Your exit portal is the way that the fomites or the germs are going to get in or out of your body. Hand washing and then controlling aerosols and splatter is going to help with the exit chain. Means of transportation. They can be transmitted through direct contact. They can be inhaled. They can be airborne. The way we're going to break this chain is through isolation, disinfection, and hand washing. The portal of entry. These are how, just like the portal of exit, how things get out, the same way that things get in. So mucous membranes, your respiratory tract, any broken skin, all of these portals of entry, you're going to be able to help break that chain by doing first aid, by bandaging up wounds and skin tears, using personal hygiene and washing microbes off of the skin whenever there's a break in the skin, and then also with the hand washing. A susceptible host is just like a person. So anybody who is a susceptible host is someone where these germs are going to invade and live in. We can break this chain by the treatment of underlying diseases, keeping people otherwise healthy, and also giving them immunizations. So your susceptible host chain of infection is broken by giving people immunizations. We're trying to make them less susceptible to an infection or an illness. Just like when you get the flu vaccine, it makes you less of a susceptible host so that if you do get exposed to the flu virus, you don't necessarily develop the flu or you don't get it as badly because you're not as susceptible of a host. So make sure we know these different chains of infection and how they are broken. With your source, again, it's without microorganisms, there is no infection. So we're going to make sure that we're washing our hands and keeping the facility as clean as possible. Things are not sterile, but we have medical asepsis where we're wiping down equipment and we're wiping down rooms and we're cleaning daily to try to keep things as clean and disinfected as possible. Make sure you're using your hand sanitizer between each patient, you're putting on your proper PPE, wearing your gloves, and then make sure you're not wearing them out in the hallway or touching anything with contaminated gloves. Your reservoir is your fomite. Again, this is where your organisms are living in the human body, animals, plants, soil, food, water, anywhere where an organism can grow. Making sure that we are breaking this chain using your environmental and food sanitation, also with antibiotics. If you could see the germs, you'd wash your hands every day, all day long. Your chain of infection with your route or portal of exit is how it gets out of your body. So when you are sneezing or when it's airborne or you're bleeding and it's splattering on people, those are the natural openings or unnatural surgical openings where these infections can get out of someone's body and into someone else's. It's also coming out of their bladder when they're voiding or stool when they're defecating. So we need to make sure that you're wearing PPE when you are dealing with anyone's urine or stool. Definitely when you're dealing with anyone's blood. You're going to break this chain of infection with your hand washing and your PPE barriers. Your modes of transmission, we're going to talk about some more a little bit later, but you have direct transmission, which is person to person. You could be kissing someone, having sexual intercourse. You get the chicken pox, mono, or HIV through direct person-to-person kissing sexual intercourse. Indirect transmission is person to object. This is when your fomites come into place, where you have objects on your hand, your linen, your dressings, the tables, contaminated food, contaminated water. A good example of indirect transmission is when people get the stomach flu. The stomach flu or the gastrointestinal flu is caused by an organism called C. diff. C. diff is highly contagious, and when one person gets it, it's usually spread to other people really easily. So you will get vomiting, nausea, diarrhea from C. diff. Hands are the most common object of transmission of microorganisms in long-term care facilities. So we have to make sure we're washing our hands. Another form of transmission is your airborne or your droplet transmission. So this is when you're coughing and then the microorganisms go into the air, your susceptible host is going to breathe them into their lungs, and then they're going to get the infection. An example of this is droplets when you cough go 3 feet from your body. It can go into someone else's mucous membranes, which are their eyes, their mouth, their nose. Some examples of airborne and droplet transmission are going to be your influenza or your tuberculosis. We all got screened for tuberculosis with a TB skin test just to make sure that you are not going in and coughing out tuberculosis and giving it to the residents. Break this chain with hand washing and barriers. We have also the route of portal of entry. Same thing with your natural openings in your body. The same way things get out. You sneeze them out, you pee them out, you stool them out. They get into your body the same way. So any of these natural openings, or if you have a surgery or a break in the skin, it'll be an unnatural opening, but it still is a route of the portal of entry for the organisms to get in and invade and infect you. Break this with your hand washing and your PPE barriers. So if you have a cut on your hand, you may want to wear gloves before handling other people. Just so you have that open wound, you don't want to get it infected. Susceptible host. All people are susceptible to infections. Some people are just a little bit more susceptible than others because of their disease state or their underlying diseases. They could have some kind of conditions. They could be treated with steroids. They can have chemotherapy that weakens their immune system. Any kind of break in their skin after a surgery. If you're using any kind of equipment, like they have a catheter in, or simply because of old age or young age, they're more susceptible of a host. These people definitely need to get their immunizations. Everybody in healthcare needs to try to get an annual flu vaccine, but definitely the very young and the very old, these susceptible hosts need to get immunized. Okay. Your signs and symptoms of infection. So you need to know these signs. You're going to have a fever sometimes. You can have redness or swelling at the area, or heat or fever directly at a cut or incision area. An increased pulse and respiration. Usually their heart rate is going to be higher and their breathing rate is going to be higher. Okay? They're going to show signs of distress in their vital signs. That's why it's important to report abnormal vital signs immediately. If they complain of any pain or tenderness in an area, if they have any fatigue or loss of energy, if they have any loss of appetite or anorexia, if they're nausea, vomiting, diarrhea, any rashes or sores, any redness or swelling, those are more obvious signs of infection. But there are also silent infections. People have HIV and you don't even know. That's a silent whole body infection. Okay? Nosocomial infection. Know that this word means an infection that's acquired after admission to a healthcare facility. The person came in fine, but once they started a few days after being at the facility, they developed some kind of infection. It can be a gastrointestinal infection, it can be a respiratory infection, any kind of infection where there was normal flora or microbes that were transmitted to the person from another source that then caused them to get ill. E. coli is normally found in your colon. The bowel movements contain E. coli, but if this E. coli gets into your urine, it causes you to have a urinary tract infection. So maybe your patient came in, they had some stool that wasn't cleaned up right away, or you wiped them the wrong direction. You're supposed to be wiping from front to back to prevent cross-contamination, but you're wiping them from back to front, or the stool stayed in their brief or adult diaper way too long, and it got into their urinary tract. Now they have a urinary tract infection from the E. coli that was growing in their stool. Still considered a nosocomial infection because they didn't have it on admission, but they developed it after being at the facility. Microbes are going to enter your body through equipment. When you're using equipment, going from room to room, you are supposed to wipe down that equipment with a disinfectant wipe before taking it into another patient's room. Any kind of therapies that we do to patients, if we start an IV, if we draw blood from them, we make a break in their skin, they could possibly get some infection from that. Money is a dirty form of things that we pass from person to person to person. This is just a little example about different kinds of microorganisms. They found E. coli, fecal matter, rhinovirus, Staphylococcus aureus, all of these infections that cause the whooping cough. And then some of the currency has cocaine on it. So just think about you're passing money from person to person to person without washing it. Same thing when you're using your hands, going from person to person to person without washing them. You're transmitting microbes to other people. Most common sites for nosocomial infection is going to be the urinary tract system, the respiratory system, and then any wounds or surgical incisions that somebody has. It's going to get into their bloodstream. Older persons have a hard time fighting these infections off. So it's really important to notice the signs of infection early, report any abnormalities to the nurse so that we can get them started early on a treatment. A lot of times if someone comes in with a urinary tract infection, they're going to have some neurological cognitive deficits. They're going to be agitated. They're going to be incoherent. They're going to have some neurological changes that aren't normal for them. And we can check their urine, and 9 times out of 10, they have a urinary tract infection. So if you notice someone's behavior changing, if they ate less, if they drank less, if they participated less, if they are more agitated than they normally are, then make sure you let someone know. Our body does have natural defenses that help prevent us from getting infected and also helps kill off infections when we are exposed to them. So examples of this are our epithelial tissue, which is the lining of our body cavities that lines our bodies, that our skin is made of epithelial tissue. We have tears in our eyes that keep infection out of your eyes. You have cilia or hair like your eyelashes, your nose hairs, even some inside your ear that capture little particles in the air before they get into those orifices or mucous membranes. We have white blood cells that are called leukocytes that attack foreign bodies when they come into the body or the system. So when you have pus around an area, that is a outpouring of white blood cells or leukocytes trying to kill or engulf those microorganisms that are invading. So, how to prevent infection. If only one link in the chain of infection is broken, then transmission will not occur. So the best way to prevent the spread of infection is by hand washing. Most important element of hand washing is friction. So they've done lots of studies that say even if you don't have any soap, it's best to use some soap because the suds help with the friction. But even if you don't have soap, you rub your hands briskly and together, and that will help get the germs off of your hands. Okay? If your hands touch the inside of the sink at any time during washing, you have to start over with applying more soap and then washing again. Okay? The video we're going to watch is me going through hand washing. The only difference now is that you need to make sure you're drying your fingertips first when you dry your fingers. Dry your hands, but make sure you're using a clean paper towel to dry off your hands and another clean paper towel to turn the sink or faucet off.
Come in.
Hello, Mr. Mims.
Hi.
Hi, I'm Tanya. I'm going to be your CNA today. I'm going to do some skills on you, but first I'm going to wash my hands.
Okay.
So you're going to turn on the water. You're going to turn on the warm and the cold side. You're going to test it and make sure that it's comfortable. You're going to push up your watch or your sleeve from your uniform and wet your hands. Your fingertips are pointing down at all times. You're going to put about a teaspoon of soap and rub your hands vigorously with friction for at least 20 seconds. You're going to wash your wrists and every surface, interlacing your hands, pointing your fingertips downward, and never touching the inside of the sink. You want to use your fingernails on the palm of your hand. And then rinse. Grab a clean paper towel and dry your hands. Dispose of that paper towel. Grab a clean paper towel and turn off the faucet. Dispose of that paper towel. Done.
Okay, when should you wash your hands? Before and after each shift that you work, before and after each patient contact, after using the bathroom, before and after handling food, after handling anything that you think is dirty or contaminated, which includes soil dressing changes. So even if you need to change your gloves and wash your hands while you're doing a procedure, do it as often as you need to. As soon as you take off your gloves, you have to wash your hands. Gloving or using PPE does not replace hand washing. You should wash your hands immediately upon removing gloves. Okay. You also need to wash your hands before and after cleaning an area, before and after handling any body fluids, and before or after smoking any cigarettes, before and after wearing your gloves or PPE. Your personal protective equipment is PPE. Must be removed before you leave the room. There are different forms of PPE that you can wear. The CDC, is the Centers for Disease Control and Infection, regulate the use and proper use of PPE. But make sure that you are taking it off before you come out of the room. You can't walk down the hallway with PPE on. That includes gloves. So make sure that the outside of your bag is clean. You take off your gloves and you handle the bag with clean hands after you've washed them. Okay? Your gloves can be latex or vinyl. If you have a latex allergy, you can wear vinyl gloves or you can wear the nitrile gloves, but let your employer know if you have a latex allergy. You'll have itchy redness on your skin and skin breakdown. You'll know if you're allergic to the latex gloves. Always wash your hands. Barriers do not replace hand washing. If you're wearing a gown, you must wear the plastic gown or apron. You cannot wear a patient gown in place of a plastic isolation gown. Isolation gowns are long-sleeved and they have a permeable, non-permeable barrier in them that keeps liquids out and off of your uniform. You can wear masks sometimes. When you're wearing a mask, you're going to remove it whenever it gets moist. When you're breathing, you have humidity in your breath that's going to make your mask moist or wet, and that's going to let it be more permeable for infection to break through. So if maybe every 20 or 30 minutes, if you feel like your mask is moist, you change it. Eye protection, like goggles or face shields. Sometimes they're attached to the top of the mask. Sometimes you put them on separately. If you feel like that you're going to get splashed in the face with something, you could wear this eye protection or these goggles. Hair nets and shoe protectors. You're going to wear hair nets whenever you go into a kitchen area or if you're going into surgery. You're going to wear shoe protectors if you're working in surgery or in an OR. Okay? This is a video about the personal protective equipment.
Remember, you should always wash your hands before donning any PPE. If indicated, put on a mask. Adjust the mask to cover both the nose and mouth. Tie upper strings on top of head, then tie lower strings at neck. If a mask with elastic straps is used, adjust elastic straps. In general, your mask should be changed when it becomes moist or after it has been worn for 20 to 30 minutes. Next, put on a gown if needed. Hold a clean gown by the neck in front of you and let it unfold. Put your arms through the sleeves. Tie the strings at the back of the neck, then at the waist, overlapping the back to cover your uniform. If your gown becomes wet or torn, it should be changed. Next, apply your gloves. Remove clean gloves from the box or dispenser. Place your hands into the gloves. Adjust your fingers for comfort. If a gown is worn, pull cuffs of gloves over wrists of gown. If gloves become visibly soiled, torn, or punctured, they should be changed. Remember that you may contaminate the environment and clean surfaces with soiled personal protective equipment, particularly gloves. When you are ready to remove the personal protective equipment, use these guidelines. Remove the gown by untying waist ties. Remember that the waist ties and gloves are considered dirty and should be treated as such. Remove your gloves. Since used gloves are considered clean on the inside and dirty on the outside, touch only the clean inside during removal. Grasp the outside of one glove below the cuff and pull it off with the clean side out. Continue to hold the removed glove in your gloved hand. Place the fingers of your ungloved hand inside the cuff of your gloved hand and pull it off, turning the glove inside out over the other glove. Discard gloves as biohazardous waste or in a covered container according to facility policy. Wash your hands before removing your mask and/or gown. If the resident is in isolation, some authorities recommend hand washing with antibacterial soap for 60 seconds. Remove your mask if worn. The ties on the mask are considered to be clean, but the mask itself is considered to be dirty. Untie the mask at the neck, then at the head, touching only clean ties with clean hands. Remove the mask touching only the ties. Avoid touching the face or hands with the body of the mask. Handle it by the ties only. Discard the mask as biohazardous waste in a covered container or according to facility policy. Remove your gown if worn. The neckties and the inside of a used gown are considered clean. Untie the clean neckties of the gown with clean hands. Grasp the neckties at the back of the neck and pull the gown off the shoulders. Slip the gown down the arms and over the hands, touching only the clean inside. Roll the gown away from you with the clean side out. Once removed, discard the gown according to facility policy. Once your PPE is removed, wash your hands.
Okay. Fourth,
We are going to be applying our PPE. For this step, we are going to need our gown, gloves, and an appropriate biohazard container if you have been in an isolation room where there is droplet precautions, or your gown and gloves are soiled with blood or body fluids. First step, wash your hand. Get your gown and let it unfold in front of you without shaking it. And then sliding one arm through, slide the other arm through, and tie the neck strings first. You're going to make sure that the neck strings are tight around the top of your neck so that it covers your uniform completely and it is not saggy in the front. You are then going to overlap the rest of your gown, making sure that it covers your uniform completely, and then tie your waist string also in the back, making sure that they are tight and will not come loose during your procedures. You are then going to apply your gloves. The first glove goes on, making sure that the cuff of the glove is on top of the cuff of the gown. Putting the second glove on as well, making sure that the cuff of the glove is on top of the cuff of the gown. Now you are ready to enter your room. When you are done and you are removing your gown and gloves, you are going to take and grasp the palm of one glove, pulling it off into the gloved hand. Take two fingers, putting them under the cuff of the other glove, pulling it inside out onto itself, and disposing of it in the appropriate waste container. You're then, without touching the rest of your uniform or gown, untie your neck string first, and then untie the waist string. Without contaminating or touching the front of your gown, you're going to pull the gown off your shoulder, turning it inside itself, wrapping it, and turning it away from your body onto itself and disposing of it in the appropriate waste container. You then wash your hands, and you are done.
Okay, so for national testing, you're only going to be doing your gown and your gloves. The CDC is in charge of the order of donning and removing your PPE. So that last video that we watched was a little bit an older video. There is a new update now. So the sequence for donning your PPE. Make sure you know putting your PPE on is called donning. So the gown goes first, then your mask, then your goggles or face shield, then your gloves. Okay, make sure you're practicing that way to put them on. And then doffing or removing your PPE, taking it off. The gloves come off first, then your face shield or goggles, then your gown, and then your mask. It says mask or respirator because sometimes you're going to be wearing a particulate respirator when you have a tuberculosis patient. We'll talk about that in a few minutes. But make sure you remember you practice the donning all of the equipment and doffing all of the equipment in the correct current order. Standard precautions are used to be called universal precautions. The CDC recommends that we use these to prevent the spread of blood-borne viruses. So there are different types of viruses that are spread by the blood only. Anytime you come in contact with someone's blood, you're going to use a standard precaution, treat anybody's blood as though it could possibly contain one of these viruses. There are several different types of hepatitis. The two main types of hepatitis that are blood-borne are going to be your hepatitis B and your hepatitis C. Both of them are treatable now. You used to not be able to treat hepatitis C, but now we have a new medication for that. But make sure you know that hepatitis B is when you come in contact with infected blood or bodily fluids. It's not usually through contact with water or fecal oral route, but it is blood-borne. And also hepatitis C is blood-borne. You usually have to get a needle stick or come in large contact amount with a person's blood. If you get a needle stick, you have to report it immediately because there is a chance that you could contract some kind of communicable disease from someone. Everybody knows about HIV. Definitely it is blood-borne, so you can't just get it from sharing silverware or sharing plates or touching a patient. You actually have to have some kind of blood-borne transmission with them. The hepatitis A is a fecal oral route. That is one that you can get from poor sanitation, from crowded living conditions, from going to third world countries on mission trips. Hepatitis A is one that you get by contact, but not necessarily contact with blood. It's contact through food and water and hugging and kissing and coughing and sneezing. Though you still could use standard precautions, but it's not going to be a blood-borne pathogen if it's hepatitis A. Okay. Basic concern is that all human beings have their blood and bodily fluids, wounds, mucous membranes, treated as it is infected. So if it is wet, warm, and not yours, don't touch it without gloves on. If you see a rash on somebody, don't rub your hand over the rash to see what it feels like, because rashes are contagious by contact. Hand washing, gloving, making sure you're using masks and eyewear and face shields. You can use these standard precautions even if someone is not on isolation precautions. You can wear a gown if you feel like you're going to come in contact with vomit or emesis or feces or urine or blood. Make sure you have you're caring for the residents' equipment, cleaning it down between each contact with different residents. Wipe it down with the disinfecting wipes that are in the basket. Your residents need to be using disposable things as much as possible. Make sure they have their own personal care items, that you're not sharing shampoos and deodorants and hair combs and things like that. Environmental control. Make sure you're wiping down and cleaning off side rails and tables and overbed tables, things like that. Your standard precautions also include the way that you're carrying and handling your linen. So linen is a fomite, and you need to hold it away from your uniform. Even if it's not visibly soiled, you're going to put gloves on to take linen off of the bed. You're going to handle the linen in a way that it is not touching your uniform, whether it's clean linen or whether it's dirty linen. Some places the policy is that when you're getting linen out of the clean utility room, you put it in a bag and you carry it down the hall in this bag so that it's not touching your uniform. Your occupational health and bloodborne pathogens, there are standards for that you learn about in in-services every year. And we want to make sure we're never recapping needles or other sharps. Make sure you're putting sharps like disposable razors in proper sharps containers. Patient residents. Patients that we know are infected cannot be in a room with another patient who has an open surgical wound or who has a Foley catheter. Or if two patients have the flu, they can't be in. If one person has it, the other person doesn't, then we need to move that susceptible host out of the room for the patient that has the flu. So OSHA is the bloodborne pathogen standard. So OSHA is a federal agency that protects resident or employee rights. And OSHA has a bloodborne pathogen standard That's part of their rules and regulations, federal agency that you need to know about, that you're following this bloodborne pathogen standard everywhere that you work.
Standard precautions are taken to prevent the transmission of infection through blood and body fluids, even when the resident and staff do not know that an infection exists. The germs that cause infection are too small, and the resident may not appear ill. Some of the supplies you may need include liquid soap, paper towels, trash can with step-on lid and plastic bag liner, gloves, surgical mask, gown, and face shield or goggles. Apply the principles of standard precautions for the care of all residents when contact is likely with blood, body fluids, mucous membranes, non-intact skin, secretions or excretions, with the exception of sweat. Standard precautions apply to blood, body fluids except sweat, secretions, excretions, mucous membranes, and non-intact skin of either the resident or the nursing assistant. Thoroughly wash your hands or any other skin surface that has contacted blood, body fluids, secretions, excretions, mucous membranes, or non-intact skin. Wash hands before and after each resident contact, and before applying and after removing gloves. The purpose of wearing gloves is to protect yourself, protect the residents from pathogens that may be present on your hands, and prevent the spread of pathogens to other residents, staff, and visitors. The following guidelines should be followed when using gloves. Wash your hands before applying or removing gloves. Wear clean, disposable examination gloves for anticipated contact with blood, body fluids, mucous membranes, non-intact skin, secretions or excretions, or items and surfaces that have been contaminated with any of these things. Apply clean gloves immediately before touching mucous membranes or non-intact skin. If you were wearing gloves before the contact, apply a clean pair. Wear gloves if you have breaks in the skin of your hands or if the resident has a rash or broken skin surface. Change gloves if they develop tears or holes or if they become visibly soiled. Change gloves between different procedures and body sites on the same resident to prevent cross-contamination. Change gloves immediately before moving to a new area of mucous membranes or non-intact skin. You should remove and discard gloves and wash your hands at the following times: promptly after use, after each resident contact, before touching other residents, yourself, or other people, and before touching non-contaminated environmental items or surfaces. This may require that you change gloves several times during the care of a single resident. Take care that you do not contaminate environmental surfaces with used gloves. And finally, avoid wearing gloves unless necessary. Use of gloves decreases direct contact by touch and causes residents to feel physically and psychologically rejected and isolated.
Okay, so just make sure you're wearing gloves appropriately and taking them off when you enter or when you exit before you exit their room. Your special equipment, your sharps containers are these hard, rigid plastic containers. They don't have to be red, but they have a biohazard symbol on them. They're usually at the nurse's station. There's some in the restrooms as well, where we can dispose of disposable razors or needles that they're using for insulin, or little finger stick needles that you use to check people's glucose with. Preventing needle sticks is part of the exposure control plan. Making sure that patients or that employees are vaccinated with hepatitis B vaccines. If you were born in the 1990s, you probably already have a hepatitis B vaccine series. It's given to people now when they're infants, and it's supposed to last a lifetime. If you were born before the 90s, then you could go and get this 3 vaccine series to help prevent you from contracting hepatitis B. So there is also a post-exposure follow-up. Whenever you get a needle stick, you need to be followed up for the next few months to make sure that you are not developing some kind of HIV or hepatitis from that finger stick or that needle stick. Spills need to be cleaned up appropriately. We'll talk about the blood spill kit. Chemicals need to be cleaned up appropriately. We'll talk about the MDS sheets, Material Safety Data Sheets, MSD sheets. Special equipment and supplies. We're going to use waste that goes into special bags that has the biohazard symbol on it. These bags do not necessarily have to be red, but they can just be a yellow bag or a different color bag that has this biohazard symbol. Waste that requires special handling for pathological wastes like cultures, liquid blood, contaminated items that release blood when they are squeezed or compressed need to go into this biohazard bag. So these biohazard bags have this symbol on it that say biohazard. Now if you just have a little bit of blood sprinkled on the bed sheet, it's not going to leak out. You don't have to put it in a biohazard bag. Biohazard materials have to be disposed of properly. They have to be incinerated if they're trash. They have to be cleaned separately if they're linen. But it is only biohazard if it's a large amount of bodily fluids that's not dried up on the bed sheets or the linen.
You should wear a clean gown when indicated to protect your skin and clothing from splashes or sprays of blood or body fluids. Do not wear a regular resident gown in place of an isolation gown, as it will not provide the same protection. Wear a clean mask and goggles or a face shield when indicated to protect your skin and the mucous membrane of your eyes, nose, and mouth from splashes or sprays of blood or body fluids. You may wear a mask without eye protection, but you should never wear eye protection without a mask. Follow facility policy for needle and sharp precautions. Use caution when handling used needles, razors, and other sharps to avoid puncture wounds and exposure to bloodborne pathogens. Needles are never bent, broken, or recapped by hand. Discard used sharps immediately after use into a puncture-resistant container. Promptly clean blood spills following your facility policy. Avoid picking up broken glass with your hands. Use a broom and dustpan, tongs, or an instrument. Handle linen and equipment soiled with blood or body fluids carefully. Contain these items in plastic bags, kept clean on the outside, or another covered container according to facility policy. The outside of the bag or container should be color-coded or labeled according to facility policy. Double bagging is not necessary unless the outside of the bag accidentally becomes torn or contaminated. Clean and disinfect contaminated environmental surfaces according to facility policy. Discard biohazardous waste items according to facility policy. Consider laboratory specimens and specimen containers to be potentially infectious material. Store them in a container labeled with the biohazard emblem. Keep them away from areas where food, beverages, and clean items are stored. Avoid placing specimens in a refrigerator with food, drink, or medications. Use good judgment in applying the principles of standard precautions and selecting the personal protective equipment according to the task being done. And remember that personal protective equipment will only protect you if it fits properly, is free from defects, and used properly every time.
Okay. There are special incidences when we have isolation precautions. These are also called transmission-based precautions. We know that the person has an infection or a communicable disease, and we don't want to spread that infection to others. All body fluids, including blood, secretions, and excretions, can transmit these microorganisms or pathogens. It says in the videos, except sweat, but if you want to put on gloves when you're touching a sweaty person, you can. But sweat is not supposed to be transmitting these infectious diseases. The Centers for Disease Control and Infection has these guidelines for isolation precautions when we know someone has this problem, or these problems. This is a picture of scabies on the person's neck. So like I said, if you see a rash on someone, don't touch it. Scabies are actually little mites that infest the skin, but they're highly contagious, just like lice. Precautions are going to depend on how the pathogen is spread. Someone who's sneezing into a tissue. That tissue is not going to be a biohazard, doesn't need to go in a biohazard waste container. If the person is not infected with a communicable disease and they just sneeze into a tissue with some mucus, you just throw it in the regular trash can. Okay? Your transmission-based precautions, the biggest spreads, the way they're spread is through airborne precautions like tuberculosis, droplet precaution within 3 feet of the person that sneezed or coughed, like the flu, or contact precaution, which is the most common precaution used because it is actually when you're contacting the person or contacting a fomite. So, things that are spread through contact precaution that you need to know are scabies, shingles, MRSA, VRE, your gastrointestinal infections like your stomach flu, your C. diff, and your hepatitis A. All of those are contact precautions. You touch something, either a fomite or the actual person, and then you can get infected from that person. Your residents are not allowed to leave their rooms because they're on isolation. Sometimes they're going to feel like they did something wrong or they're being punished. But you just need to remind them that you are trying to protect them from spreading disease and also helping those germs from getting onto you or helping them to understand the risk that they give to other residents if they were to get the disease from them. Be sure to remove your PPE before you exit their room. And again, that list of donning your PPE, putting it on with gown, mask, face shield, gloves, and removing your PPE or taking it off with gloves, face shield, gown, then the mask. This is a video about transmission-based precautions.
Transmission-based precautions are used to help prevent the spread of certain highly transmissible, known or suspected pathogens by airborne, droplet, or contact spread. The licensed nurse or physician will determine the need for isolation, select the type of isolation, and provide instructions for isolation precautions. You should not fear the resident or the disease if you use transmission-based precautions correctly. When a resident is in isolation, it will be necessary to protect the nursing assistant and others by utilizing both standard precautions and transmission-based precautions. It is important to teach family members and visitors the proper use of precautions. Isolation hand washing should be performed following facility policy, which may include removing watch and other jewelry on the hands and arms, rolling sleeves to the elbows, washing both the hands and the exposed areas of the forearms, using antimicrobial soap, and washing for at least 60 seconds or as directed by your supervisor or facility policy. Now we will discuss some specifics about transmission-based precautions. First, we will look at airborne precautions. An example of a disease requiring airborne precautions is tuberculosis. Airborne precautions are utilized to control infections spread by tiny pathogens that remain suspended in the air and travel over long distances on dust and in air currents through the ventilation system. An airborne precautions room will have a special air handling system. Supplies needed for airborne precautions include the following: liquid soap, paper towels, trash can with step-on lid and plastic bag liner, gloves, and a NIOSH-approved mask. A private room with special ventilation is used to keep the pathogen from spreading. It is imperative that you keep the door closed, except when entering or leaving the room. Apply a HEPA, N95, PFR95, or other NIOSH-approved respirator before entering the isolation room. To wear these masks, employees must meet certain medical criteria. It is important that you wear an approved respirator, as airborne pathogens will pass through a regular surgical mask. Be sure to check for air leaks each time you apply the mask. Men with facial hair cannot wear the HEPA mask because facial hair prevents a good mask seal and causes leaks. Special hoods may be worn in place of the mask. Always wash your hands before entering and before leaving the room. In some facilities, only certain employees may be assigned to work in rooms where airborne precautions are used. Droplet precautions are used in addition to standard precautions to control the spread of infection through large droplets that enter the air through sneezing, coughing, laughing, talking, and singing. The droplets remain within 3 feet of the resident and do not remain suspended in the air. Examples of diseases that require droplet precautions are some childhood communicable diseases and some forms of pneumonia. Supplies needed for droplet precautions include the following: liquid soap, paper towels, trash can with step-on lid and plastic bag liner, gloves, and surgical mask. Wear a regular surgical mask when working within 3 feet of the resident, and always wash your hands before entering and before leaving the room. Apply the principles of standard precautions when necessary during resident care.
Okay, so making sure that you are wearing a mask that's appropriate. So the tuberculosis mask is a different mask that you have to get fitted for. You wear a size. It comes in like regular or small or large. And the biggest thing to remember is that the tuberculosis is an airborne transmission. It's going to just transfer in the air. It doesn't have to be within 3 feet of the person. So we need to make sure that we're closing the patient's door. And then also men, if you have a beard, you're not going to be able to wear this mask because it needs to make a tight seal on your face. If you're pregnant, you also don't need to be taking care of tuberculosis patients. So you need to let your charge nurse know if you're pregnant. Other parts of the infection control policy is cleaning, disinfecting, and sterilizing. Things in the facility are going to be clean. We're removing soil from objects. It's done with water, detergent, and scrubbing. Disinfecting is the process of eliminating most but not all microorganisms. On your Lysol and Clorox containers, it says kills 99.9% of infections. So these special chemicals are disinfectants. They're sometimes combined with detergents. Sometimes you have soaps that are just regular soap, and then you have some that have antimicrobial soaps. Sterilization is the complete elimination of all microorganisms. The only way that things are sterilized are through heat and steam. So this is not normally done in long-term care facilities. We don't sterilize the environment. We only sterilize things in the hospital or if it's being used for surgeries. So you're disinfecting, keeping things as clean as possible with medical asepsis. We're making sure that it is free of these disease microbes. We're also bathing our patients with antimicrobial soaps or with detergents to help get the microbes off their skin, to help prevent the spread of infection. We're trying to remove or destroy as many pathogens or microorganisms as we can to prevent them from spreading from person to person or person to object. Surgical asepsis is your surgical technique where I said things are going to be sterilized. So make sure that you know that sterilization does not happen in long-term care facilities. Things that are sterilized are when you're in a surgery. Okay. the clean utility area and the dirty utility area. When you go into the clean utility area, make sure you are just getting the supplies that you need, because once you take it out of clean utility, you cannot store it in the patient's rooms. You cannot take it from one room to another room. You have to use it in the room that it's intended to be used for that patient, and anything that you don't use then goes to soiled utility. The clean utility room only gets stocked with clean things that have come back from laundry or that come in from the supplies like bandages and basins and tapes and urinary catheters, oxygen equipment. All of that stuff is stocked when it's clean, but once it comes out of the clean utility room, it does not go back into the clean utility room. It goes to soiled utility even if you haven't used it. So make sure that you know that soiled utility has a lock on the door, because we don't want people wandering in the soiled utility area and possibly getting contaminated with anything. Alright, your dirty utility room has hoppers, has trash cans, dirty linen hampers. There are some signs on the doors that tell you what go in there. Some facilities want you to put linen in one spot and then clothes or laundry in another spot. Bedpans, urinals get rinsed out in the resident's bathroom, in the toilet only, or in the soiled utility room with a spigot that's there designated for cleaning that. But you don't rinse the bedpans or the urinals in the resident's sinks. We're going to go over that when we do our chapter on intake and outputs.